A few years ago, a 42-year-old male patient of mine complained that his baby tooth that was retained finally started shaking. You can see in the x-ray that there's not much left of the tooth, and one day he bit on an olive and the tooth finally came out. The problem was that the roots of the tooth behind it were turned into the spot, and an implant is not always the solution because I couldn't place an implant there. We decided to go ahead and make a temporary bridge that went into the extraction side, or where the tooth came out of, to give it a real life effect as if the tooth is coming out of the gum. This is the scan of the provisional restoration. It is made out of plastic and it is used to shape the gum around it rather than having the bridge sitting on top of the gum. This way, we reduce the amount of plaque and debris that gets underneath to essentially zero. My assistant likes to call it the Dr. Kaufman Pontic, but I couldn't take all the credit. The tissue does a beautiful job. When we see that it fits absolutely perfectly into the tissue and supports it, and the tooth looks as if it's coming right out of the gum. You can see the provisional on the master model, and you can see when we take it off how beautiful the tissue and the tooth looks. And on the final picture, you see a couple years post-op of the canine and the premolar behind it. We love it.